all the
Yeah,
students,
just
this is going to be
hold
a
on.
mock exam session. Please be interactive. You can also write in the chat box or can unmute your mic. So we'll be starting. The topic for today is respiratory medicine CCS session. And the faculty that we have here is Dr. Asif Iqbal sir. He is a HOD Respiratory Critical Care and ECMO Services at Apollo Multispeciality Hospital, Kolkata. Thank you, everyone.
So, student, this is a CCS session for the respiratory medicine. Usually, in the respiratory medicine, the commonest topic for EDIC Part 2, they will start with the community acquired pneumonia, and they will go on either if it is a long case, then they will give you the 5 variant, and if it is a short case, they might give 2 or 3 variant. So it is just a example of the cases. Like you will get first variant where actually they will not say the first one is the variant. They will, this is that it is a scenario. So you will get the scenario and you will get time approximately 10 minutes where this will not be like a short presentation. Short presentation. So they will give the details of the patient scenario and the investigation report and all. And from that point, you have to note down the problem. And when the exam will start, you have to prompt your answer. Remember, there is a no negative marks, but there might be a multiple answer. So don't say only one answer. You give maximum answer which is so there is a then there will be a chance of increase getting increased number or increased scoring. So this is a 65-year-old male admitted with a altered sensorium, complaining cough, fever for last 2 days and respiratory distress. On examination, pulse is 112, respiratory rate 32, BP 90/60, SpO2 89 in the room temperature, ABG showing mild acidosis and low PO2. Just one call. Anjanda ki code diyeche? ট্যুরিস্ট ভিসাতে এত তাড়াতাড়ি ট্যুরিস্ট ভিসা দিচ্ছে না, ঠিক আছে? ওরা হচ্ছে যে ট্যুরিস্ট ভিসা হচ্ছে যে আজকে ইয়ে ছিল, হ্যাঁ 7 দিনে চলে এলো, 15 তারিখের আগে হচ্ছে অ্যাপয়েন্টমেন্ট দিচ্ছে না ট্যুরিস্ট ভিসার। 9 তারিখ অ্যাপয়েন্টমেন্ট চেয়েছিলাম, দেয়নি ওরা। ওরা 15 তারিখে অ্যাপয়েন্টমেন্ট দিচ্ছে, 15 তারিখে অ্যাপয়েন্টমেন্ট দিলে আমার আর যাওয়া হবে না। সেই জন্য আমি বিজনেস ভিসা অ্যাপ্লাই করছি। বিজনেস ভিসা হলে হচ্ছে যে আমি একটা পেয়ে যাওয়ার চান্স আছে। কালকে আমার অ্যাপয়েন্টমেন্ট আছে বিজনেস ভিসা। দেখো যদি সকালবেলা হচ্ছে যে কোডটা দিতে পারো, আমি তাহলে হচ্ছে ইনভিটেশন লেটারটাকে হচ্ছে যে ড্রাফট করাতে পারবো, ঠিক আছে? ওকে, ঠিক আছে, আমি একটা ক্লাসের মধ্যে আছি, আমি তোমাকে পরে ফোন করছি, ঠিক আছে? On examination, this is the ABG. Now, when this type of scenario you will get, so probably you will get this type of question: what is the case? So I will request someone, please, can you please volunteer and Sana?
Yes, sir.
So anyone who will do volunteer from here, so he or she only can prompt this answer. If you have
Anyone
problem,
can
I will.
unmute the mic, please.
So anyone, we will continue till the end. So Priyanka, you want to continue?
Yeah, yes, sir. Yes, sure, sir.
Okay. So till end, Priyanka will be with me, and okay. So Priyanka, when this case, when the examiner will ask what is your case, so that means they want to get the summary of the scenario, what you have, we have, they have given. So they want to know the positive point and the important negative point, if any negative point is there, to establish your diagnosis. So it is very clear cut cases. Sorry, it is a mistake 35. It is a 65 years old altered sensorium patient with a history of cough, fever, and the respiratory distress, and there is a your hypoxia, and the respiratory distress is there. So you please summarize your case.
So this is a middle-aged male patient with the altered sensorium and features suggestive of lower respiratory tract infection. Patient is little bit tachycardic and hypotensive, and tachypneic also, and the patient is having hypoxemia, mild hypoxemia on room air. So this looks like a case of community-acquired pneumonia.
Yeah. So next question will be, what is your differential diagnosis or provisional diagnosis? So yes, you tell one diagnosis you have already mentioned, that it may be case of community acquired pneumonia. So what will be your differential diagnosis over here?
It could be aspiration pneumonitis. It could be pulmonary edema, pulmonary embolism. It could be the etiology could be varied, like bacterial, viral, fungal infection, or it could be tubercular also. Uh,
Very
and
good. So as much as you can give clue on the, so it is a pneumonia, obviously community acquired pneumonia, but you will utter that aspiration pneumonia. You will utter that it can be bacterial, viral, and fungal pneumonia. Tuberculosis, obviously you will utter, and also you will utter some pulmonary edema, maybe other causes. Okay.